Hello, everybody. Welcome to the Art of Healing with your host, Dr. Judy Jasek of Animal Healing Arts, and Matt Rowe of ParsleyPet. During our show, we are talking about your pet's health, raw feeding, and alternative treatments for cancer, unexplained illnesses, and supporting your pet's natural ability to heal. Welcome, Dr. Judy, to this week's show.
Thanks, Matt. Happy to be here as always.
Yeah, this one should be fun. Is what we're talking about today is why does my dog have diabetes? And you're seeing this happen more and more in animals today. And also, even in human culture, we're seeing diabetes is almost an epidemic that is coming out. And so addressing diabetes and how do we help our dogs achieve this ultimate health that we want them to have and not be in pain and suffering and problems or anything like that. So let's just start really simple. How does diabetes start in an animal?
Well, diabetes is an elevated blood sugar. That's where it starts. We have a blood sugar that is too high. And there's two basic forms that we look at in animals, type 1 and type 2. Type 1 is usually the type that dogs get, and it's a deficiency of insulin. So insulin is the hormone that actually modulates the glucose level. So the glucose level goes up, the insulin's going to come on board, it's going to drive it into the cells, it's going to turn some of it into fat, it's going to do what it has to do to keep that blood sugar level down in a normal range. When the blood sugar gets too high and stays too high, then we see things like excessive water drinking, excessive urination, because their body's literally trying to dilute out this glucose in their bloodstream. They're hungry all the time because they have this glucose in their bloodstream, but their cells are not able to utilize it as a fuel due to the lack of insulin. So why does that happen? Well, insulin is produced by the pancreas. The pancreas does a lot of different things. You know, we think of it a lot as for producing digestive enzymes, which it does do, but it also produces insulin, certain cells in the pancreas. And so why does the pancreas not produce enough insulin in some individuals? There's a lot of thought now that this is an autoimmune issue, which goes back to over-vaccinating and not feeding appropriately and things like that, disrupting the immune system. But regardless of the cause, if the pet doesn't have enough insulin, we have to supplement with insulin or their sugar is going to stay too high for too long, and then they can get into a metabolic crisis. If that happens, if we don't start to get it under control. Type 2 diabetes is more caused by diet. And this is the type that's becoming so prevalent in people because of all of the carbohydrate ingestion. And actually what happens in type 2 diabetes is we get insulin resistance. So there's enough insulin, but we're hammering the body with so many, especially processed carbs, i.e. kibble foods. We're hammering the body with these carbs over and over and over again. That blood sugar is going up and down and up and down and up and down. And the body just loses its sensitivity to insulin. It's kind of like the little boy that cried wolf. Like, okay, this has just been going on so long. It's like the body loses the ability to appropriately respond to the insulin that's there. And so the body can't regulate the glucose level. But those individuals can be helped tremendously by getting them off of the carbs. And this is actually quite a bit more common in cats because cats are obligate carnivores. They need to be eating a meat-based diet. You put them on a processed carb diet and they get fat, they get really heavy, and they're really prone to this type 2 diabetes. I had a case that I saw just a couple of weeks ago, and I did a check-in with her because we were talking about changing the diet and doing different things. And she said, well, my cat's like staggering, like losing its balance. And I said, well, That's actually a good thing because the cat was already on insulin. I said, what that means is that we're lowering that blood sugar and your cat needs to come off of the insulin, which can actually happen with diet changes because the body, when we're not giving the body all of those processed carbs, the body can re-regulate. So we've got this cat on a meat-based diet, and I suspect we'll get this cat off of the insulin completely. We don't go cold turkey, of course, we're going to wean it off. But I think we're probably going to be able to get this cat off the insulin. And even in, like, say a dog has the type 1 type diabetes, where the body just isn't making enough insulin and we have to supplement, diet is still really, really huge because it helps regulate the blood sugar. So when they're on a fresh food diet as opposed to a processed carb diet, the blood sugar stays more stable in general. And usually we can get the insulin dose that they need way down, and they just feel better. Even, if they still need to stay on the insulin, pets on insulin and on a processed carb diet, their blood sugar, again, it's going up and down, up and down. I mean, they eat and they get the sugar spike and then it goes down. So to keep that blood sugar stable with, a couple of insulin injections a day is almost impossible. When they're on a low carb diet, fresh food, meat-based diet, like they're supposed to be eating, then we can, even if they still need a little bit of insulin, we can still keep that blood sugar a whole lot more stable. And they feel better, and more energy, they look better, maintain their weight better. It's just better for them all the way around.
And so what you're really talking about is balance, is at that point is with that carbohydrate, but like let's say kibble-based high carbohydrate diet, you're going to see those swings where it spikes up and then it drops down, and those that roller coaster. But when you're going after a more protein would be the wrong term, but more of a meat-based fresh diet, you're starting to create some sort of a level plane to allow the body to somewhat start healing again and start to absorb the right amount of insulin so it doesn't spike as much. So it's that hard swing up and the hard swings down. I have heard too that a food high in saturated fats, and then when we put sugar with that fat, is what really drives. So think of, you are going out to Kentucky Fried Chicken and you're eating that high saturated fat diet, and then we have the cake that they give you at the end. So lots of sugar, lots of saturated fat in conjunction with each other. But with our pets, we're giving them this high sugar content with carbohydrates with it. And also we have rancid fats, and we have the fats that are in the food itself. And over time, this would eventually throw off the cell to stop absorbing that sugar inside the cell, or the insulin inside the cell.
Right. Yeah. Processed unhealthy fats are definitely bad for metabolism, and fat and sugar together are a really bad combination for the body, especially like you said, if the fats are rancid. Now, healthy fats, I do work with getting pets on a more ketogenic diet, and this is where we actually are training the body to burn fat instead of glucose as an auxiliary fuel. And so this bypasses this whole like insulin mechanism, but the body has to get used to doing that. But the body's gonna burn sugar over fat. And then if there's excess sugar, it's gonna store it as body fat. So insulin really is a storage hormone. So it'll help the cells utilize the glucose that they need to function. But once the level goes beyond what the cells actually need for energy, then it's just stored as fat. When you train the body to burn fat as a fuel, fat is a much more efficient fuel. And if it's good, healthy fat, well sourced, so not from factory farmed, I actually do like animal fats that are, grass fed, that are well sourced. They have a lot of nutritional value, and getting the body more adept at burning fat instead of glucose, I think can further help stabilize a diabetic.
Yeah, that's a great point. So Now, with my dog, how would I know some early symptoms of diabetes? Type 2 specifically.
Yeah. So anytime the blood sugar goes up, they're usually going to start drinking more water. And
Okay.
usually the first thing we hear is they pee in the house because they're drinking a ton of water and you may not see them. Like you may not see Leo sneaking into the bathroom and draining the toilet bowl, but you're
Yeah.
going to notice if he pees in the house
Yeah.
because they can't help it. They're
Right.
drinking all this water and they're making all this extra pee.
Mhm.
And so it's just going in and out, in and out. And if, they don't have the availability to get outside when they need to, then they're going to have accidents in the house. They're oftentimes also prone to bladder infections because of the sugar content in the urine. So literally,
Yeah.
there's glucose in the urine. The body's trying to get rid of this extra glucose, and it
Mhm.
will try to eliminate it through the urine, and so that sugar feeds bacteria. So these pets are also prone to urine infections, and so you might notice a little blood. Again, having accidents in the house, get a urine sample checked, and then
Mhm.
lo and behold, we have a high glucose level. We better check the blood to make sure that, or check and see if they are indeed a diabetic. And then
Mhm.
they'll tend to just like not feel good. They'll be hungry a lot. They'll kind of never be satiated. A lot of times they'll lose weight just because the body can't put on fat, isn't able to use the energy that it's ingesting.
Yeah. Do you notice mood swings?
Oh, sure. Yeah. And behavioral changes.
Mhm.
I think this is starting to be more and more identified in pets on high carb diets in general, that it's like an ADD child that is given, coffee and donut for breakfast or something, like there's that sugar spike. I
Right.
guess caffeine aside, but more the sugar part, um, it just amps them up more.
Mhm.
And for dogs, those carbs make it harder for them to focus. And
Mm.
yeah, with people, and with pets, when you get those blood sugar swings, like if you eat a donut or something for breakfast, and
Mhm.
2 hours later, man, your blood sugar is crashing and you're starving. Whereas if you eat a higher protein or higher fat meal, that's going to sustain you more throughout the day, and you're not going to get that drop. We all hear the expression, "Gosh, I'm hangry." Like I
Yes.
need to eat because my blood sugar is crashing, and
Mhm.
you get irritable and that blood sugar
Yeah.
goes down. Your body's just screaming at you, "Hey, give me some more blood sugar." And it absolutely will happen in our pets. It's just sometimes a little harder to notice. You just don't realize that, oh, your pet is, your pet is, not paying attention today, harder to
Yeah.
train. I had a
Yeah.
little dog in here today for an exam. Saw this dog last year, was perfectly fine. Today, this dog didn't want me to touch her. Just, I mean, trying to bite me, literally.
Yeah.
And like, what's going on with that? So we talked
Mhm.
about the anxiety, and we
Mhm.
talked about diet, and we talked about things like that. What could be causing this dog to, just not feel like itself? So it
Yeah.
absolutely affects um, brain function, really.
Mhm. Yeah, I mean, especially if it's not absorbing the amount of sugar that it's eating. And if we are feeding kibble, I mean, carbohydrate load could be up over 50% of the diet could be
Mm-hmm.
carbohydrates with a standard kibble style product. And so, and then you're mixing rancid fats on top of that. And then everything else terrible, all the toxins that are within kibble doesn't go to help it either as well. So really now when you notice a dog and you are starting to see things that are pointing towards diabetes, you would do the blood test to see where the insulin levels are, see how the blood sugar is. Then on that side too, is there anything else you do as a protocol to, well, on those first steps with a pet parent and their dog?
Well, like we were just talking about,
Mhm.
definitely get them off a kibble diet. I take all pets off a kibble diet. I just don't
Nothing
think,
good.
well, there is no good kibble out there.
Yes.
and they're just not healthy. So it doesn't matter what's going on with the pet. I think getting them off of a kibble diet or high carb diet. And then there's other diets out there that would not be the best for a diabetic. So there are some diet formulations that have a lot of potato in, a lot of starch, these, some of the freeze dried products. And I do recommend freeze dried products in some cases. They work well for some pets and some people's lifestyle, but you have to read the ingredients because a lot of them are just have a high, really, really high carb load. So you still want to avoid the carbohydrate, especially the processed carbs. You want to avoid biscuit type treats because that's something else, that little, treat when you go through the bank or whatever, also very high in carbs. So you want to be avoiding those. So getting them on some sort of fresh food diet is going to be really important. And if they're, I guess, depending on the level of the blood sugar and what their level of symptoms are, that would determine whether or not we start the insulin right away. If the blood sugar is just a little bit out of the normal range, we don't have a ton of symptoms, the pet's still feeling pretty good, then we might try a diet change for a few weeks and recheck the blood sugar and see where we get. If their blood sugar is off the charts and they're just really not feeling good, and things like I said, peeing in the house, loss of energy, very tired, just, you can tell these pets are suffering, then we will definitely get them started on the insulin and get them stable. And then as time goes on, diet, there's also herbs. I have some Chinese herbal formulas that can help a lot in stabilizing the blood sugar. And like I said, even if we don't take them completely off of insulin, if it's a type 1 diabetic, we can usually reduce it. And most importantly, the pets feel good. They can live, normal lives. They can be out running and playing and walking and whatever they like to do. We're definitely looking at the quality of life. If you keep a pet on a kibble diet or these horrible prescription diets, which there's nothing prescription about them, except that they cost a lot. And then you're trying to manage them with insulin. These pets, I mean, you can keep the blood sugar down, but these pets are still going to feel crummy. They're not getting it's poor quality nutrition to begin with. And then it's a processed carb, which is going to continue to drive that blood sugar up. So it's like a, tug of war. You're giving insulin to drive the blood sugar down, then you're feeding a food that's continually spiking it. So getting that balanced and getting that pet to a steady state where it actually feels good and has good energy is pretty tough to do.
Yep. So have you noticed by going to more of a raw, fresh diet that has curtailed some of the symptoms of type 2 diabetes and helped regulate the type 1 diabetes over on the other side?
Yeah, absolutely. I actually don't really even see much diabetes anymore, it seems. I saw this one kitty the other day, but that kitty had been eating kibble. And so, we're getting it off of that. I don't see too many dogs with diabetes. And I think, like I said earlier, there's a lot of evidence that type 1 diabetes is autoimmune in nature. Yeah. And so the other thing that I advocate for is minimizing vaccines and pharmaceuticals and things that can disrupt the immune system, because this is where we get autoimmune disease from. The immune system just gets so dysregulated, it doesn't know what's friend or foe, and then will in fact attack itself, an organ in the body or the skin or something like that. So it's interesting you say that, and I think, gosh, seems like I used to treat diabetes all the time, and I really just don't see it as much anymore, which is a, testament to the fact that when you feed a fresh food diet and you work on good gut health, the microbiome, there's so much information coming out, new information all the time about the importance of growing the right bacteria in the gut and keeping them, keeping the bacterial populations in balance. I was actually just earlier today listening to a podcast. Now, this is from a human practitioner, but I think the principles are the same. You're asking about mood swings. And they said, yeah, depending on your bacterial population, certain bacteria actually produce substances that put us into sympathetic mode and drive anxiety.
Yeah.
And there's other bacteria that are more likely to put us into the parasympathetic mode, the rest and digest, where our bodies can heal. So keeping that microbiome balanced is super important. And even for things like diabetics, now we're still trying to learn to fine tune this. So how do we best accomplish that? But keeping that healthy gut is so important. And I work with that in my patients, and I'm sure that's contributing to the fact that, I just don't see as much diabetes as I used to.
Right. And, it's interesting. You talked about gut microbiota, that good bacteria that drives our immune system, that can outnumber the cells in your body by 100 to 1.
Yeah.
So, essentially, philosophically, we are really just bacteria.
Right.
And the good bacteria feeds our brains. And so, even in certain autoimmune conditions, Dr. Terry Walls out of Iowa City is proving with herself as an experiment. She was diagnosed with MS as a neurologist, and she went on more of a paleo-based ketogenic diet and reversed her symptoms of MS. And so that being an autoimmune condition, it's the same thing, I believe, for our animals as well. Is once we set up that good gut microbiome, that good balance of good bacteria, then it's going to help not only with brain function, but also with regulating the amount of sugars that we have and what we consume and the toxins. And if you're feeding kibble, you're feeding your dog glyphosate. That is the Roundup chemical that they're spraying on all the lawns, but they also spray it on all of our food as well, that goes in conventionally grown grains that are put into kibble, have glyphosate on them. And then you add rancid fats to it. And then you add the fact of all the other terrible things that go in kibble that I don't have enough time for, but as you research it, it'll scare the crap out of you. That you'll look at and say, why would I feed my dog this, an animal that I love so much, when I could feed it a raw-based diet and avoid things like type 2 diabetes and avoid other health conditions and try to keep cancer at bay for as long as you can by feeding more of a healthy-based meal.
Yeah. Yeah. When you look at a food label, I read food labels all the time. Whenever a client comes in and tells me what they're feeding, I pull it up because they're always changing, for one. And you pull them up and it's amazing. What will be in those foods. And when you're feeding a food, read the label on the food that you're feeding your pet. And there's a whole bunch of chemicals and you don't know what they are and you can't even pronounce them. You're making, you have no idea if that's providing any benefit or if it's providing any harm for your pet. Are there side effects to that? You have no idea how that's impacting the microbiome and these things that we're talking about. I see so many pets with, like skin issues and these chronic inflammatory conditions. I'm always trying to sort out, what exactly is going on in their body. And when we are feeding all these chemicals, the body has to work to eliminate them. So when you're feeding a whole bunch of synthetics, you're making the liver and the kidneys just work constantly in overdrive to eliminate them. And it puts the body in a constant state of stress. And like we were saying, the body needs to be in this parasympathetic mode where it can relax and digest and heal and reduce inflammation. If you feed a basic fresh food diet, you're going to have 5 or 6 ingredients and you're going to know what they are: meat, bone, liver, kidney, spleen. You know what all those things are. It's whole food. And it's real food. And it does sometimes take some tweaking to get, an individual pet on the diet that's most appropriate for them. But fresh food is just absolutely the key. And, you mentioned glyphosate. Glyphosate was originally labeled as an antibiotic. So what do you think that's doing to the microbiome? And we talk about how antibiotics can be so hard on the gut and can kill off all that good bacteria. If you're feeding a food with glyphosate, you're killing that bacteria every time the pet eats something.
Yep.
So you're never going to have it. It would be impossible to have a healthy gut if you're feeding a food like that.
Yeah, when bacteria is so critical for our health and our pets' health.
Mm-hmm.
So now with everything that you said, so you would say that with your protocol on getting ahead of diabetes is go see your vet, get the blood sugar tested, but also transition the pet to a fresh food diet.
Mm-hmm. Absolutely. Absolutely. And most conventional veterinarians are going to put the pet, I know there's prescription diets out there, supposedly to help with diabetes. But again, you read the ingredients on these prescription diet label, there isn't that much difference between any of them. They're not that much different than your average grocery store dry food. It's all kind of the same crap. They just put a different label on and charge more for it. So, avoid that. Get in touch with me or, with Matt, and we can help you get your pet started on a fresh food diet. And they're just going to be so much healthier, and it's going to make a condition like diabetes so much easier to manage.
Yeah. Amen. That's so well said. So if they want to get in touch with you, Dr. Judy, to have that conversation about their pet diabetes or raw feeding, what's the best way they can get a hold of you?
Well, my website is ahavet.com. That's Animal Healing Arts is the name of my practice. Our email is info@ahavet.com, and our phone number is 720-515-2421.
And you will do a telemedicine approach to this as well, where they can book an appointment, and through Zoom, just like this video is being done, you can actually have a conversation with a pet parent about their dog that may have symptoms of diabetes or raw feeding or any other ailments that may be unexplained or they can't put their finger on, and having a conversation with you from an incredible holistic veterinarian that is going to look at it from multiple angles.
Right. Yeah, you can have lab work sent over. I can review that, and we can chat on the phone and see what we can come up with.
That is awesome. And you can always reach out to us. Like Dr. Judy said, is every dog's a little bit different on exactly what are the nutrients that they need inside their body and what should be the levels of bone be in the actual mix I'm feeding my dog, and how much muscle meat and how much organ meat is my dog getting enough iron. And this can all be seen with the nutritional blueprint test through ParsleyPet. So just go to ParsleyPet.com and you can read all about the nutritional blueprint and see if it's right. See if it's right to determine if whether or not your dog should be adjusting his nutrient levels and his diet just a little bit. So thank you very much, Dr. Judy, for being on the show today. I really appreciate all your wisdom and advice and help for all these great pet parents out there.
No, always happy to be here. I appreciate everybody that's willing to tune in and perhaps learn something a little different and open their minds and try something new for their pet.
Amen. I love it. All right. Enjoy the day, Dr. Judy. And I hope everybody out there has an incredible day with their pet.
Bye, everybody.
See ya.